My name is Dr Bob Ryder from Birmingham in the United Kingdom, and I'm talking today about the duodenal jejunal bypass liner. These are my disclosures, and this is a duodenal jejunal bypass liner, also known as EndoBarrier or more recently Reset, and as over the years it has been more commonly referred to as EndoBarrier. That's the term I'm going to use in this presentation. It's a 60 centimetre impermeable sleeve implanted during a simple endoscopy procedure into the first part of the small intestine, such that the food passes through it rather than the small intestine, and it mimics the bypass bit of the Roux-en-Y bariatric procedure. It's left in place for up to 1 year before being removed. In view of uncertainty about the relative risks and benefits of EndoBarrier, in 2017, the Association of British Clinical Diabetologists set up an independent registry of EndoBarrier treated patients, and as of January 2025, data have been collected on 1,298 patients worldwide, and you can see here their baseline demographics. In particular, I point out the BMI almost 40, and the fact that not all the patients had diabetes, some just being treated for obesity. This is what happened during the year with EndoBarrier. They lost 30.7 kilograms. Hemoglobin A1C dropped from 8.4% to 7.1%, and there were also big improvements in blood pressure and cholesterol. I pointed out that not all the patients had diabetes, and so we stratified the impact on hemoglobin A1C according to baseline hemoglobin A1C, and you can see the higher the hemoglobin A1C, the greater the impact, such that if the hemoglobin A1C was greater than 11%, the fall was 3.9%. There were some serious adverse events, 4.6% of the patients, and most of these, 2.4%, were gastrointestinal bleeds. But it was noteworthy that the rate of liver abscess was 1.2%, and this is noticeably less than the 3.5% found in the FDA pivotal study known as ENDO. There were some less serious adverse events, and this is a typical such patient. You can see that because of pain, her EndoBarrier was removed at 6 months, but nevertheless by then she'd had a major improvement in her hemoglobin A1C. She'd lost 43 pounds and also a considerable reduction in her requirement for insulin, and 3 years later this improvement was sustained. This gentleman not only came off insulin, but his hemoglobin A1C actually went into the normal range, and you can see in his case the improvement was sustained with time as well. This lady here was on insulin for diabetes and also had obstructive sleep apnea requiring continuing positive airway pressure ventilation, and you can see after the treatment with EndoBarrier she not only improved, having lost 48 pounds, but she no longer required the CPAP, and this improvement was again sustained in her case. This lady not only had an improvement in her diabetes, but also an improvement in her renal function, and again this improvement was sustained. So in summary, the mean weight loss during the period of EndoBarrier implantation was 13.7 kilograms. The higher the baseline hemoglobin A1C, the greater the fall of 3.9% with those with a hemoglobin A1C at baseline of greater than 11%. The rate of serious adverse events was 4.6%, with the majority, 2.4%, being gastrointestinal bleeds. The rate of early removal of hepatic abscess, 1.2%, was noticeably less than the 3.5% found in the US pivotal study known as ENDO. All patients with serious adverse events made a full recovery, and most experienced considerable benefit from the treatment despite the adverse event. So in conclusion, the effects of EndoBarrier therapy on glycemic control, weight, blood pressure and cholesterol are likely to reduce the complications of diabetes. This international data from the EndoBarrier Worldwide Registry suggests that the likely benefits of EndoBarrier treatment far outweigh the risks.